Thank you very much and good afternoon. Today, to start with, our case update, we have had 514 new people diagnosed with COVID-19 in British Columbia, including 6 epidemiologically linked cases, bringing our total number of people diagnosed with COVID-19 to 66,779 in British Columbia. That includes 134 people in the Vancouver Coastal Health Region, 223 people in the Fraser Health Region, 29 people on Vancouver Island Health, 71 people in the Interior Health Region, and 57 people in the Northern Health Region. We now have 4,557 active cases in every health authority, of whom 292 people are in hospital, 74 of whom are in critical care or ICU. We have at least 7,000 people still now under active public health monitoring, and 59,551 people who have recovered to various degrees, as we have learned, from COVID-19. Sadly, we have had an additional 5 people who have died from COVID-19 in the last 24 hours, bringing that total to 1,189 people. Our seniors, our elders, our family members, our friends, our community members. And to all of the families, the care providers, communities who have lost people, our thoughts and condolences are with you again today. We have had one new healthcare facility outbreak at the Holy Family Long-Term Care, and sadly that is a single case so far, and we know that the investigation will continue there. On a positive note, the outbreaks at Mayfair Seniors Living Care, at Morgan Place Care Family Facility, and at Little Mountain Long-Term Care are now over. And I know the tremendous sense of relief that will be for the family members, the care providers, and the communities who have watched and have had loved ones involved in those outbreaks. We now have 25 active outbreaks in long-term care and assisted living and 9 in acute care units, involving 926 residents and 520 staff in long-term care. And while we've had no new outbreaks or clusters in communities, we know there are a number of ongoing ones in communities around the province today. Since the start of our Immunize BC program, 87,346 people have received a COVID-19 vaccine in BC, and of these, 4,262 people have received a second dose. And it is also very exciting to share that all long-term care residents and the people who care for them have been offered vaccine in all health authorities around the province. And we have very high uptake, and details of that we will be providing in the coming days. Our vaccine supply, however, is proving to be a challenge, with, as we've reported on before, the Pfizer vaccine having no doses arriving this week and reduced doses for the following 2 weeks. We are reassured that that will increase again in the 3rd week of February, but that does leave us with a much less supply than we were intending. And today we were advised that the supply of Moderna vaccine that's scheduled to arrive next week has also been reduced by about 20% due to some difficulties at the Moderna processing plant. Of course, this is disappointing for all of us. We are working with what we have available to best address those most at risk and those hotspots and outbreaks that are happening in communities around the province. But starting next week, we will be getting back on track. It will be slow and slower than we wanted, but we are confident that we will be able to meet our Phase 1 and Phase 2 objectives as quickly as we possibly can, and that we will be ready once we have vaccine to be able to offer it, as we've outlined, to everybody starting in April. I think everybody will agree that this has been an extraordinary and challenging year. And today in particular, as I stand here again, I'm struck by how most, if not all, of our normal rituals to mark things like significant changes in our lives, even our day-to-day rituals, have been thrown apart and reassembled in ways that many of us may not even recognize. Everything from births to deaths, weddings, anniversaries, graduations, all of those markers of those important milestones in our lives, all these transitions, along with the ceremonies that we use to mark these with each other, with our families, with our loved ones. Even our daily rituals have changed, but we have adapted. We've adapted to wearing masks. We've adapted to keeping our distance. And we've adapted by being able to support each other. We have learned so much in this year. We've learned as well that we are connected, a global community in ways that perhaps we have not appreciated before or perhaps had ignored. And therefore we've learned that what happens in a remote community in China affects us here. What happens in a production facility in Belgium affects us. But we've also discovered that our individual actions can and do make a difference every day. That taking the individual actions to keep ourselves and our loved ones safe are also the very things that keep our communities safe. Every time we keep our safe distance, we wear a mask, we clean our hands, we stay home when we're ill, all of this makes a difference for those we love and for those we don't know. We in BC and in Canada have weathered this storm this past year by doing our bit individually and therefore collectively. We have all benefited. We have done this by bending our curve, not the rules, and by standing together and staying apart. And over time, through these months, we've learned that crises such as this pandemic can bring out both the worst and, thankfully, the best in our human nature. It's times like this when altruism is so important, and we have seen so much of that in this past year. People dropping off food for neighbors, caring for others' children, looking out for each other, looking out for our neighbors, supporting our food banks. These are things that have made a difference to us in our communities and our families across the province. As well, we have seen that when we have many unknowns, as we have had and continue to have, even to some extent today, misinformation and fear can fill those gaps because we are fed by our own past experiences, by rumors, by stories, by media, and of course, social media. But we have responded in BC by recognizing our need for connection, for compassion, and for community. Acknowledging that we are in this together, even though we come from very different places. It is our sense of common purpose that will build that resilience to support us all as we continue through this storm. We have also learned that we can be resilient and adaptable, even when it is hard. That social connections, even virtual, are essential. That compassion is stronger than cynicism, and that there is still joy and beauty in this world, even when we are faced with unrelenting uncertainty, as we all have been in this past year. This pandemic, as I have said many times, and all we must do to weather it, is not forever, but it is for now, and it is something that continues, even in this period of hope and challenge. It is our community and our compassion that will see us through this storm. I know we will be together again. I know we will be able to take off our masks. But in the meantime, our task right now is making sure that we continue, as we imagine that future from the middle of this storm, that it remains our time to continue to be kind to each other, to be calm, and to stay safe.
Thank you very much, Dr. Henry, and I want to start by recognizing and sending my condolences, and that I think of everyone in the province, to the families, the friends, the caregivers of the 5 people who passed away in the last day from COVID-19 in British Columbia, 3 in Fraser Health, 1 in Northern Health, and 1 in Vancouver Coastal Health. Their loss, especially at this time, especially after this 1 year since our first case, is as difficult now as it has been throughout the pandemic. And I want to assure everyone that our hearts and our thoughts are with them today. I want to note, Dr. Henry noted that we have 292 people in hospital diagnosed positive for COVID-19 at present, and that is relatively lower than it was earlier in January, and obviously that's a good sign. In terms of our hospital capacity, which we periodically update you on, that's 88.7% of beds are occupied of base beds. That leaves us unoccupied 1,063 base beds at present in our healthcare system. When we count the surge beds that have been put in place, that occupancy rate is 70.2%, leaving 3,553 beds available. In critical care, 75.4% occupancy of our base beds, leaving 131 critical care beds unoccupied, and 51.9% when you count the surge beds that have been put in place. And that's 372 beds unoccupied. So we continue in terms of our healthcare system and acute care to manage across the province. But that doesn't mean there aren't significant issues. You will know significant issues at Royal Inland, significant issues at St. Paul's, significant issues in parts of the province that have higher rates of COVID-19 right now. And the challenge everywhere in our healthcare system of dealing with a pandemic and dealing with everything else continues to be there. I want to note, as I update you on our surgical renewal commitment, you'll note that health authorities resumed non-urgent surgeries on May 18th and have completed a combined total of 229,504 surgeries as of January 24th, 2021. In terms of the most recent completed week, we've done a completed assessment, which is January 11th to 17th. Health authorities have verified their data, and the total number of surgeries completed between January 11th and 17 was 7,282. That is 426 more surgeries than the same week last year. And as noted, considering the pressure in our healthcare system, that is an extraordinary achievement by our healthcare workers, by our surgeons, and by our nurses in the healthcare system, and everyone involved in dealing in continuing surgeries, and it's a real achievement for everyone. I appreciate, I want to make sure that everyone understands the effort that has been made up to now to deal with that situation. I also would note that we continue to make progress in immunization and long-term care, and most importantly, we're seeing fewer outbreaks in long-term care. The end of the long-term care outbreaks, particularly at Little Mountain and at Morgan Place, which had a profound effect on those communities, is something we recognize, and while we contemplate all that everybody involved has been through. We had 2 weeks ago 42 outbreaks in long-term care. We now have 23 active outbreaks. We had 7 outbreaks in assisted living and independent living combined. We now have 2. And that is progress, and it reflects our immunization effort. Dr. Henry noted, and we will be providing on February the 8th, detailed facility-by-facility data with respect to immunization rates, but the total numbers are significant. As you know, we've 129,241 people across the province have been vaccinated, and in long-term care of residents, that number, and this is not final, every long-term care facility has now had clinics, but it's 26,584 residents, 33,708 staff to date, and 7,846 assisted living residents, 4,290 assisted living staff. So those are significant, and that represents significant progress, and we see that progress reflected in our results. And obviously, it's very gratifying. The day an outbreak is declared, I know this from personal experience, the day an outbreak is declared is a terrible day for any residents and family, and the day that it's declared over is a day of relief. And we want to note that today in these cases and note the progress we're making, but everyone needs to understand that while vaccination and the first dose vaccination is one step, that we have a long way to go and we have to keep doing our work. I wanted to speak about a question that I was asked at an earlier event today with respect to a case in the Northwest involving the hospitals in Kitimat and Mills Memorial Hospital in Terrace and the loss of a child. And this is obviously a terrible thing to experience. And our hearts go out to the family. To maintain confidentiality and privacy, we cannot speak to the specific situation. However, we expect those in our healthcare system across our province to provide culturally safe care to Indigenous people and all patients, no matter the situation. Allegations of racism are always taken extremely seriously. There is no place for racism in our healthcare system, and any discriminatory or racist behavior is a violation of our principles, policies, and values. Northern Health has initiated a review which will work with the family and the healthcare providers to determine exactly what happened in the situation. We acknowledge that systemic anti-Indigenous racism exists in BC, and while some steps have been taken to make healthcare safe and accessible, there is much, much, much more to do, as Dr. Mary Ellen Turpel-Lafond's report has demonstrated. In closing, I wanted to say that as we move through the pandemic, we can worry that COVID-19 is always one step ahead of us. We know that COVID-19 lives to spread. But what I see in my community, and I know it is happening in every community, is people taking the actions necessary to stay one step ahead of COVID-19, doing what's required and often more to keep themselves and their families safe to stop the spread. And I want to speak to all those people just briefly who are doing well beyond what we're asking them to do to stop the spread. And just to say that we recognize you, we see what you're doing, we understand what you're doing, we understand that many people are not visiting family members who they love and want to see because they want to protect them from COVID-19. We see that action. We understand people feeling an evident frustration and thinking, how much more can I do? Because you're doing more than you're being asked to do. And I say we just have to continue doing that. And I want to express our appreciation. There are some people who need to do more. And it's never too late to join our effort to stop transmission of COVID-19. We need to use our skills, we need to follow our guidance, and we need to abide by public health orders. And when we do that, we help put COVID-19 in our rearview mirror. We keep COVID-19 one step behind us. The compassion we show and the example we set remains the lead to follow. When it comes to COVID-19, stopping the spread keeps us one step ahead. And that is something we all need to reflect on this weekend when we're making decisions. This is a critical time, a critical moment in the pandemic. We are making progress in some important areas. There are real challenges ahead. And I want to say thank you to everyone. Thank you to everyone for all that you've done in the last year on behalf of all of us, to protect those you love and those you don't know. And we know it, we see it, we thank you for it, we appreciate it. Thank you.